Hi, welcome again to our sessions of digital slide review and sign out, part of the Digital Anatomic Pathology Academy. I'm Dr. Louis Hassel, and I'd like to share with you a case today that not terribly dramatic, but somewhat of an interesting novelty. And it's part of what we have begun to term the interesting incidentals that we come across in pathology that makes pathology so engaging and interesting. So this was an uncommon finding in the endocervix in a patient who had a hysterectomy for benign disease. So there was nothing particularly concerning in her history. But I thought it'd be interesting and a good chance to review kind of normal histologic findings and anatomic findings in the cervix. Here on the left, you see this nice diagram or photo of a bivalved uterus. The endometrium is up here at the top, somewhat triangular in shape, and surrounded by the pale pink tan myometrium. The endocervix steps here from the squamo-columnar junction up here to the isthmus, and usually has this slightly rugated or herringbone type of surface. The stroma of the cervix usually is this more whitish tan and mostly fibrous tissue with a little bit of muscle out here towards the end, the periphery that connects with the myometrium very loosely. When we look under the microscope, as you see here, you see typical endocervical type epithelium has basal nuclei and is pale blue, slightly pink cytoplasm, surrounded by this very loose stroma of spindle and stellate shaped cells with no significant atypia or muscle being present. So that's kind of the normal background and the normal cervices that we see in that setting reflect that completely. So I was somewhat taken aback when looking at this cervical section. We saw this slightly raised area here. And over here we can see, I think, fairly normal appearing endocervix, a nice sharp squamo-columnar junction here. But I began to be a little struck by some features here, which were a little bit unusual in the sense that there's these nice strands and bundles of smooth muscle here. And they're sort of haphazard. They're not really organized into any sense of fascicular architecture. And as you can see there, these are more deeply seated. And they're along with other more organized structures and so forth. So a little bit of that type of muscle here, perhaps not unexpected to occur in a little bit of an unusual setting and perhaps related to the myometrium slightly. But what really caught my eye was what's going on over here. And here we see nice endocervical glands, some deeper extension of these glands. And notice we have this nice pink tissue here in the stroma. And as we come into higher magnification, I think you'll be able to appreciate that this also is smooth muscle type tissue. It's got the fascicular architecture, bundles and running in different directions, very pink cytoplasm, and very bland appearing nuclei. And obviously it's quite distinct from the surrounding normal endocervical mucosa. Well, that would have been an interesting isolated finding, but the other sections from the cervix had an even more pronounced change. So here's kind of the opposite figure from the cervix. And here, or from the previous section, and here again, we see a sharp squamo-columnar junction located as would be expected. Normal endocervical stroma and glands and so forth here. A few scattered bundles like this, as we observed previously. But then we have this almost band-like proliferation of smooth muscle that looks like an exaggerated muscularis mucosa with even some endocervical type glands deep to it. much as we saw on the other slide. And here we can see a few upward extensions of this kind of muscular tissue into the stroma. So descriptively, I would have termed this sort of a myomatous transformation of endocervical stroma. It's obviously benign, not something that's going to affect the patient's longevity or anything. But I was very intrigued, and so I did a little further search and came across this quite interesting study from about 20 years ago, from a retired professor, emeritus professor from the University of Cape Town, describing his findings in a couple of series of hysterectomy specimens looking for this type of smooth muscle. In fact, he found it in up to 25% of the cervices. Now, some of them were just those little isolated bundles, such as I initially showed you, but a few of them, up to 4 or 5%, had a more generalized proliferation or extension of this type of change within the lamina propria, within the submucosa, subepithelial tissues of the cervix, in much what we've described here. He found in his study that this did not seem to be associated with hormone status, whether they were taking estrogens or otherwise, or progestins, nor was it associated with the presence or absence of leiomyoma to any significant degree. So he concluded that this was a normal variant, a morphological variation without pathological indication. I was shocked at this percentage because this is something of this sort is certainly extraordinary in my experience. And while it certainly appears to be benign, I was quite struck by it. So I'd be interested to know what your experience is, whether you've seen this and otherwise, and whether you termed it a metaplasia, which he concluded was not likely given the status. Oh, he also noted that it seemed to decrease with age, and the prevalence of the smooth muscle findings in patients over 60 was much lower than it was in patients in their mid-30s and 40s. So my final sign-out diagnosis was benign endocervix with myomatous transformation, maybe hyperplasia, maybe metaplasia. It's a change of the benign endocervical stroma. So with that, we'll conclude today's program. Thanks for listening. And please share your comments or thoughts, especially if you've seen something similar or have any conjectures as to its genesis. We would be very interested in your thoughts. Thank you very much for hitting that like button and subscribe so you'll catch future releases from our program as we try to post things of an interesting and engaging manner a couple of times a week. And so until next time, thanks so much for joining me.